fiber supplements?
Fiber is good, but there are two kinds of fiber. There's soluble and there's insoluble, and they are not the same. So soluble is what goes into fiber 1 bars, that psyllium, inulin, pectin, like what holds jelly together. That's good. I'm not saying it's bad, but you need the insoluble fiber, the cellulose, the stringy stuff in celery, the cardboard, if you will. Together, they form this gel that we talked about earlier. If you only consume the soluble fiber, which is what the food industry will add to food, because the insoluble fiber is not miscible, if you only add the soluble fiber back, you're not getting the benefits of the entire fiber complement.
Earlier, when talking about the NOVA system and how most all of our foods are let's say, I know it was 7 to 10%, let's say 95%. Let's err on the side of better. 95% of our food should come from NOVA system class 1 or class 2 foods.
Or 3.
Or 3, okay. Staying away from those NOVA class 4 foods. Yep. Could you give us some examples of NOVA class 1 and class 2 foods, just broadly speaking?
Okay. NOVA class 1 is any food without a label. Period. If you see a label on a food, it's a warning label.
Well, there's ground beef has a label. Okay, so that's...
Well, does it?
So you're talking about apple. Well, when I buy it, it has a label. I'm asking this because people are going to wonder. So,
well, it doesn't have a nutrition facts label. Is there a nutrition facts label on a thing of ground beef?
I buy that ground beef where I consume venison, where if you flip it over, it says how many calories, how many proteins. So there's a label. But it's just beef or venison.
Okay. Then that's class 1.
Okay, egg?
Egg is class 1.
So, and then of course fruit, apples, orange. Okay, so it doesn't matter if it has a name tag as long as it doesn't have an ingredients
nutrition
list.
facts label.
Got it.
Real food does not need a label. It's only if they did something to it that it needs a label. So you have to look at every label as a warning label. Now, the problem with the label is it only tells you what's in the food. What you really need to know is what's been done to the food, because it's the ultra-processed food that's the problem. They don't want to tell you that. That's secret. Okay, secret from a proprietary standpoint, but also secret because if you knew what they did to it, you wouldn't eat it. You would never buy it. And they don't want you to know. So they only tell you what's in the food. That's not what's important. It's what's been done to the food that's important. And that's why this NOVA Class 4 is so important, and that's why Perfect is so important, because it'll do the work for you.
Great. We'll definitely provide links to all of these. So if you could pick one thing to recommend to people that want to improve their health.
Get rid of the sugar.
Okay.
Period.
Very clear.
That's number 1. Number 2, go for a walk.
The exercise piece. Yeah.
Go for a walk.
And if you could recommend one thing that the general public can do to try and assist in this advocacy for not redefining, but actually clearly defining what is food and what isn't, and making people aware at the level of policy and change and school lunches. I mean, if there were one thing, what can we do? I mean, you've clearly activated my neurons surrounding like the set of problems that exist and the paths to correct them. But should we be writing to our congresspeople? Should we be getting angry at hospitals because they've got all these fast food machines and that the cafeteria food is like illness promoting?
At UCSF, we've gotten rid of all sugar beverages. We have the Healthy Beverage Initiative. So
no Coke machines at UCSF?
No Coke machines at UCSF.
Wow, Stanford, check that out, because people always send me pictures of the Coke machines in the School of Medicine. I'm like, listen, I didn't put them there, but we
have to model for the public. I mean, where was the first place that smoking was banned? Hospitals, okay? Because we knew. So if you get rid of the, soda, if you get rid of the sugared soda at the hospital, you're telling people something. So yeah, I think that every hospital and really every public venue in America needs to clear out the junk.
So post photos of junk that are supposed to be in health promoting institutions, and I guess we're trying to cancel junk food. We're trying to cancel junk food. I'm pretty opposed to cancel culture, but here we go. We're going to cancel. Marvelous. It's actionable. It's straightforward. It's low cost, low time investment, zero cost, very low time investment. So thank you for that.
And look up Eat Real, because we're doing it for your kids. So you need to help support it. Any school district in America can do it. So what do? We have a business model whereby the food services director either purchases or rents a dilapidated factory in the center of the district, repurposes it into a food preparation facility. They can make 27 to 30,000 meals a day, okay, with a skeleton crew, and then they and you control what's in it. And because you're buying in volume, it actually reduces the cost, so it's cheaper than buying it from Cisco or Aramark or Sodexo or wherever. And then you farm it out via, truck or bus to all the different schools. So every kid gets a hot meal made from scratch each day, and we can solve this problem.
Can't help but ask this one last question. For people that want to cut out sugar, which you clearly stated is the most important thing to do for one's health, how do we know how much sugar is in something? So should people be looking at labels and just looking for how much sugar, how much carbohydrate, or could we even go so far as to say if it says high fructose corn syrup, then it's on the no-fly list? Don't eat it.
So the problem is that there are 262 names for sugar, and the food industry uses all of them. And the reason they use all of them is because they can include a different sugar as number 5, number 6, number 7, number 8, number 9 on the list. And when you add it up, it becomes number 1. They hide it in plain sight, and they do it on purpose. Now, do I expect everybody to memorize all 262 names? No, of course not. Can you figure it out yourself? Well, the answer is no, unless they have the line where it says added sugars. If it says added sugars, it is either sucrose or high fructose corn syrup. No one's adding lactose. Okay, that's not happening.
Or glucose.
They're not even adding glucose because glucose isn't that sweet. Glucose is not that interesting. You don't see people going around chugging Karo syrup, do you? Okay, that's glucose. Who cares? Yeah, it might be good in the molasses cookie, but that's it. All right? So it's fructose. So you need to know what's been added. So if it says added sugars, that's a good place to start. No greater than 1 teaspoon per serving. No greater than 4 grams per serving of added sugars. Anything greater than that, leave at the store.
And aim for those Nova type
and
1, type 2.
Aim for Nova types 1, 2, and 3. And if you don't know whether it's Nova type 1, 2, or 3, you can use Perfect. And if you don't look at that, then go look at the nutrition facts label, and anything that has more than 4 ingredients is Nova Class 4.